Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Welcome to the Health Flow Podcast. This is episode number 21, and today I'm so pleased to have my guest, Miss Dayatra Arnold. She is well known as Day. I've known her for over 10 years. She's been doing my hair and my daughter's hair, and just any one of my friends and family that I can convince to have her do their hair. She's wonderful. She does great work. So Day is not just, in addition to her being a hairstylist, she's also a trichologist. And the reason I have her here today is just to, just to get, we want to talk about hair care. And this is probably one of many series to come and where we'll share about hair care. So, Day, welcome to the Health Flow Podcast.
Thank you. Thank you for having me. I'm happy to be here.
And I'm happy to have you. So, do you mind explaining to us what a trichologist is?
Yes, a trichologist studies the scientific study of the hair and the scalp. The trichologist specializes in all matters relating to hair and the health of the hair.
Gotcha. Okay. So, your scalp and the hair itself.
Exactly. And
Oh,
that's because the the scalp determines what type of hair you're going to produce. You have to have a healthy scalp environment in order to bring about healthy hair.
gotcha. So, if your scalp is not healthy, more than likely you won't have a healthy head of hair.
That's right. And even if it seems as though you do, it's not as healthy as it would be if
Okay.
your scalp environment was healthy as well.
Got you. Was there any additional training that you had to do to become a trichologist?
Yes, a certified trichologist has studied and successfully completed a recognized trichology educational program. To become a certified trichologist in the United States, the trichology course must be authorized and governed by a post-secondary board of education. Please be aware that not all trichologists are trained in the same way, and it is not against the law for an untrained person or a knowledgeable hairdresser to call themselves trichologists. There are many hair loss clinics around the U.S. owned by specialists that take a 3-day seminar with no formal training in hair loss and scalp diseases that will call themselves a trichologist.
Gotcha. So it's really up to the consumer to
Do their
verify that this
research.
person
Exactly.
is really trained to be a trichologist.
Correct.
All right.
Mm-hmm.
Um, let's talk about. I know for some women, and I remember a friend of mine. She's like, you need to do something about hair because, as a woman in my 50s, I'm losing my hair. Let's talk about causes of hair thinning or hair loss.
Okay. And there's many. We're going to discuss a few.
Okay.
And in her case, if it's that age realm that you just mentioned in her 50s, there could
Right.
be a host of problems. First, there could be a hereditary issue. Um, but more than likely, it's a hormonal imbalance. unless there's some underlying health issues there.
Right. Right.
There could be, let's see, to name a few, alopecia areata. There could be an issue of Hashimoto's, vitamin and mineral deficiencies, as we were speaking about before, an unhealthy scalp environment, medication, lupus, autoimmune disease, one of the major causes, which houses the Hashimoto's, lupus, MS, and things of that nature, causes inflammation to the scalp, and then therefore you lose your hair.
Gotcha. And I guess also not maintaining, like you said, a good, clean
That's
scalp
right.
environment, or
Mhm.
even products now, hair
Yeah,
products. You know,
yes, that can definitely cause a lot of the hair issues that we're seeing today. To name a few, dimethicone. Dimethicones can alter your hormonal balance internally. It's an endocrine disruptor. And then you have formaldehydes. And I know that people think that that's very odd to hear in regards to products and personal care products, because it's in quite a few things, lotions and things of that nature. And did you know that they do not have to disclose the amount of that there is formaldehyde in a product if it's less than 0.01?
oh,
So you have to be very careful with not only just reading the ingredients, pay attention to your body and how your body performs or how your body reacts to certain products. Um,
gotcha.
we all know that formaldehyde is a carcinogen, it causes cancer.
Right.
So, yes, you have to be very careful with what you utilize on your scalp, your hair, and your body for that matter.
I got you. I understand. Now, let's talk about some hairdos. So, as in not hairdo the style, but what are some things that people should make sure they are consistently doing when it comes to hair care?
Okay, hairdos. One, use the right brush. Hair cuticles help keep the hair strong and guard the inner cortex from moisture loss or damage. Unlike skin cells, hair cells do not regenerate. Once they're past the scalp level, it's gone. It's gone. So, which means it's very important to minimize daily wear and tear of the hair shaft. One of the most common causes of cuticle damage is a boar bristle brush. It can tear away sections of the hair cuticle, weakening your strands. Choose a pedal brush with a plastic rounded prong, with plastic rounded prongs.
Right. So you can increase the, I guess, the blood flow to your
Yes.
scalp
Mhm.
without disrupting the scalp itself.
Yes.
Okay, so a round plastic bristle brush is the better brush to use on your hair.
The a pedal brush with a plastic rounded prongs. And yes, it's going to stimulate the scalp, but at the same time, it's going to minimize the wear and tear of your actual hair shaft,
Gotcha.
your hair strands.
Because the other bristle brushes can
It,
destroy the hair shaft.
yes, it can. It could definitely damage your hair tresses. The boar bristle brush is one of the worst.
Okay, gotcha. Oh my gosh, and that's what most of us
Yes.
up using.
Yes, it's
Yeah.
not bad for and see, that's one of the things as well that we have to be mindful of. Sometimes what's good for the scalp isn't necessarily good for the hair, and vice versa.
Oh, I see. So that brush is just specifically for your scalp.
Just specifically, and be careful because you're still right at that hair. You're still right at the hair. So if you are utilizing it, be very careful and just gentle. and to
Okay.
massage the scalp.
Gotcha. All right. What are other, so good, knowing the right brushes to use, what
Hmm.
are some other hair do's? Um,
Okay. Um, here's a here's a hairdo. When detangling the hair,
mhm.
always start from the bottom up,
Yeah,
never from the roots down. You could tear your hair horribly. You can worsen the tangles and snap your strands.
gotcha.
If you're not using a protected head scarf or bonnet, use a satin pillowcase.
Okay.
Silk can cause a lot of heat for some. That's not, what they're looking for. A lot of coolness most time is preferable for clients.
Mhm.
Cleanse and moisturize your hair and scalp as you would your face.
Okay.
Use products that are formulated for your hair texture.
Yeah.
Descaling. We talked about we're speaking about cleansing the scalp. Um, Maybe every 4 to 6 weeks, descaling is an optimal regimen to remove dead skin, debris, medications that can very well clog the hair follicles, which would not allow optimum hair growth. Flaky scalp is known to cause or worsen hair shedding. That hair is attached to those flakes that has clogged your hair follicle. So when you scratch, be careful. You could be very well pulling your hair.
Got.
Don't ignore, never ignore flaky scalp.
Wow. All right, that's a lot of information. Now, what about, I know that we've got a whole lot of stuff going on now about, you know, there's people who perm hair and they, perm or straighten their hair.
Hmm.
Um, and there's natural hairs.
Yes.
Um, what's your, like, how often should we do deep conditioners and things like that? Should it be every time you wash your hair, you should do a conditioner and then once a month do a deep conditioner? What's your advice to that about that?
I would say when you cleanse your scalp really well and your hair, you will lose a lot of the oils.
Okay.
So preferably, I would say, and really depending upon the type of hair that you have.
Okay.
So that depends on the client that I may be working with at the time. But for most African American hair, we lack moisture. Not all the time, but for the most part. And because of that, I would recommend a deep conditioner or a steam treatment after after shampooing, or a towel steam treatment. That works as well.
Yeah, I really enjoy the steam treatment. I just feel like it goes so deep
It
and
does.
yeah, I really enjoy that. What about how do you feel about well, I'm not even going to get into that. My question was, how do you feel about people doing their own perms and things like that? But we'll just leave that alone. What about trimming? How often should you trim? Is there, do you do it every 4 to 6 weeks, or how do you decide that a person needs to, to get a trim?
I would
Get,
say, again, it depends on the client and the way that their hair grows. Some people don't have as many issues with split ends as others.
mhm.
And it's unfortunate because for myself, it depends on the client and what they have going on with the hair. But I like to touch the ends. Even if I don't cut very much at all, it could be like less than 1/4 of an inch. I like to make sure, that I touch it because it's going to have wear and tear just by everyday brushing and, the movement across your shoulders or anything of that nature. So I would recommend for most between 6 and 8 weeks. Between 6 to 8 weeks, they need to have some form of trimming to the
Yeah.
ends of the hair.
It was interesting something that you said to me. Um, what you said, like I wear my hair
Natural.
naturally curly, or I'll go straight when you make it straight,
Mm-hmm.
meaning just really blow it out because I can't really get it blown out straight, from its natural curl pattern.
Right.
And when this last time, I don't know if you remember when you did my hair, you were like, you've been wearing your hair a lot in curls, I can see, because and in the sun, because you could tell by
Yes.
it was something you said about my ends. And,
Mm-hmm.
within a matter of a week, you must have trimmed it like twice. 'Cause,
I could I could tell that your ends had been exposed to a lot of heat, and it wasn't from an iron. It came naturally from the sun.
exactly.
Yes, it came naturally from the sun. And
Yeah. So
I
the
need to
color.
take care of it.
Yeah. Yeah, I'm glad to be back so you can take care of it. All right, let's talk about some hair care don'ts.
Okay.
What are some things that we should not do?
Some of the things that we should not do is blow dry without some sort of protectant
Hmm.
on on the hair.
Gotcha.
Even with the usage of irons, always use some type of protector on your hair, and be mindful and careful because most of those oils and balms that are used are sold in the stores have that dimethicone ingredient that we were discussing earlier.
Okay. And that's
Um,
not the
yeah,
cone. We should stay away from that.
you should stay clear away from that. I would even prefer for someone to just take a very small amount. I mean, just a little dab of coconut oil and
Hmm.
emulsify it first and then
Right.
evenly distribute it, yes, throughout the hair and let that be the barrier
Oh,
between the heat and the hair.
all right. Anything else?
Um, do not go from stylist to stylist.
Yes.
Try to find someone that you trust. Research first, ask questions, get a referral. Ask someone who you know that has um, nice hair, clean, healthy hair. Ask them because you need to find someone that's going to know you and your hair to help you maintain the healthiest head of hair that you can. When they know you, they're going to know if something's going on with you internally. A good hairstylist, even if that person isn't a trichologist, knows because we're standing on top of you. We know changes that are developing even when you don't.
Right.
So you need someone that's going to be able to benchmark changes that's going on with you and know your hair, to help you, maintain or develop the type of hair that you are wanting to achieve.
Okay. All right. Tell us, this is totally different and just off the cuff, but can you think of one real success hair story that you have, like something you've done, a client who came to you consistently and you worked with her and you were successful with getting her hair from, zero to, even almost 10, in a scale of, 1 to 10, one being worse, 10 being great.
Well, there's one client that I have. Initially, when she came to me, the hair wasn't in the worst shape, but it went from maybe, let's see, approximately maybe 8 inches to now her hair possibly could be 18 inches. And I have pictures of it because it still amazes me. It's beautiful, but the consistency, and we both worked together. She took the recommendations that I gave her to heart. She changed her eating habits, and she was consistent with maintaining, her tresses, along with me, and her hair just flourished, and it's still long today, but it's healthy and long. It's absolutely beautiful.
That's amazing. That's great.
Yes.
That is good. That is good.
Mhm.
Anything else you want to share with everyone as far as hair care is
I
concerned?
I would like people to really understand that everything that you want to see on the outside starts off on the inside.
Yeah.
So it's about maintaining health. It's just being healthy emotionally, physically. You just try to find that balance. Make sure that you're taking supplements if needed and
Right.
eat appropriately.
Right.
Excuse me. Eat a balanced meal, protein, carb, and I mean like lots of vegetables and fruits. Excuse me. And good fat and lots of water. You can't
Right.
go wrong.
Well, Day, everything that you've said is everything that for each episode, whether I was talking about weight loss or diabetes or
Yes.
high blood pressure, it all comes back to
Back
the
to
same thing, mental health,
yes.
us de-stressing ourselves, because
Yes.
you could tell, like, if you're in a stressful state of mind, your hair, you could lose hair like that, thinning.
Mm-hmm.
Um, if say your thyroid is
Yes.
um, hyperactive,
Yes.
you could lose hair, or if your thyroid is underacting, your
Yes.
hair could become brittle and
Mhm.
dry and
Yes.
coarse. So it's so many things to stay in tuned, and it all comes back to balance,
Yes.
healthy eating, healthy living,
Yes.
drinking water, exercising,
Mhm.
good
Yes.
fat, stay away from bad things. I mean, no matter what, it was important because I know that your hair is important, and it just says a lot about you.
Mm-hmm.
And I mean, one day I'm sure we'll discuss, because I see hair damage from, all these weaves and glues and things that people are doing. And that's just another conversation. We'll have to talk
It
about that
is.
another day, because
Yes, we will.
that in itself is
Yes. A segment.
another,
Mm-hmm.
thing. I mean, we just need to get real and be healthy.
Mm-hmm.
And yes, you can use all those, weaves and braids,
Mm-hmm.
but it's important to protect your hair. You
Yes, it
still
is.
have to take care of yourself.
Mm-hmm. Yes. Yes. It shouldn't be that you're wearing extensions for longer than a month.
Mm.
And even if you have the extensions, you are still to see your hairstylist because she needs to go in. And if there's anything that needs to be counteracted, she could do that if she's able to see, you as the patron, to, make sure everything's in order. Because not only, I mean, people seem to forget about what goes on under the weave when they're wearing it,
Yes.
as if it doesn't exist anymore.
And one thing I say is like everything else. Germs
Yes,
like
it does.
moist, dark
Mold. Yes.
germs like
Mhm.
moist, dark
Yes, it does.
places.
All kinds of yes.
So if you have stuff covered up,
Mhm.
not getting air, not being washed, your
Mhm.
scalp
Appropriately.
health, don't
Mhm.
think that the bacteria is not going to also attach to your scalp and causes you to lose hair from the shaft. So we just encourage everyone to live their best life and have their best, healthy hair. And that start with taking care of yourself, like you said, from internal to external, decrease your stress, and find a hairstylist. I moved to Georgia over, I don't know, 13 plus years ago. And I know that I've been seeing you for over at least 10 years, if not more. And once I found you, I was not going to anyone else. That's it.
And I love you for it.
I love you too. Ariel and we love you, honey.
I love her too.
Right. You do us right. Well, thank you, Dave. Thank you so much for being on the Health Flow podcast. And we'll have to do this again.
I look forward to it. And thank you for having me.
You're welcome. Thank you so much. And I'll make sure that I include some information for anyone out there who would like to, inquire about your services and if they're local to also see you, because I know that I highly recommend you. So thank you once again.
Thank you.
Bye-bye.
Bye-bye. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.